Hello everyone, welcome to Move Well, Live Well. We've been getting a number of people coming in here with issues regarding their hip. In particular, not so much the hip joint itself, but kind of that front area, the top, if you can kind of palpate your hip bone right here, it's actually called the ilium, that top part of the bone here. So it's not so much the hip joint in here, but that part of the ilium. So right here and just below that anterior superior iliac spine right here, ASIS, just down from that, right in here, they're getting kind of sharp pain, tenderness in through here. It could be stabbing feeling kind of when they move. We see this a lot on people who are doing a lot of driving or doing a lot of sitting, because what happens when they're driving, that foot comes up off the gas, it goes to the brake and back to the gas and does this all the time. And then that hip flexor muscle group, if you can kind of come in here, just like this. If we took out your guts, and then you can kind of see this hip flexor muscle group. So you have the psoas, this is the psoas right in here, or iliopsoas if you will. And then this is the iliacus, which resides right in that fossa, the iliac fossa of the ilium here. And they get kind of this sharp pain. Sometimes it can radiate into the groin a little bit. It's kind of stabby. It doesn't go so much into the thigh, but it's kind of just right there at the anterior superior iliac spine, just down from that a little bit. And they're getting pain and discomfort with that. Well, if you look at the anatomy of this, again, the hip flexors allow for hip flexion. So if you're doing a lot of this when you're driving, you're changing from the brake to the accelerator frequently, you're going to start having problems in through there. And so how do you fix that? How do you stretch that sucker? Well, this is a stretch. If you go to our other psoas stretches and hip flexor stretches, feel free to peruse through those. But this is one stretch that a lot of people don't do. If you look at the anatomy here of the hip flexors, you see if you bent yourself the opposite way, so here you are, if this is my left, if you bent the opposite way from that, these would stretch. If you can stabilize this hip, keep this immovable, keep this stationary, and you move the spine this way, you bend this way, you're going to get a little bit of a stretch here. And so what you do, you stand planted just like this, you clench your butt cheeks a little bit, and now you stick your hip this way, so you push your hip towards that way, and then you lean in the opposite direction. You should feel a pull all in through here. And you can rotate yourself, because again, if you look at this guy, so now I'm going to go sideways here so you see. So I'm leaning this way, and then I'm rotating backwards a little bit. So I'm leaning this way, and I'm rotating backwards a little bit. So my left shoulder is going to kind of come back just a little bit. And you can feel this weird stretching through here. So again, same thing. You're standing. If it's my right side having a problem, I'm going to lean toward the left, keeping my hip. I want to keep this stationary, because this is where these two muscle groups, these two muscles, they attach right here. So I want to keep that stationary, and then I'm going to lean my spine away from that insertion point. And then I can bring my right shoulder, just kind of rotate back, and I can kind of oscillate in that end range right there. Whew. We just got back from a long drive from visiting relatives out of town. And now, from all that driving, I got tightness in through here. And so my iliacus and my psoas are a little sore from doing that driving. So here I am. This is a great stretch to do. Again, you're going to stand straight with your feet planted, and you're going to clench the butt cheeks just a little bit, and you're going to, for me, it's the right side, so I'm going to lean away, keeping the hips stationary that way. I'm going to lean the opposite way, and I can just feel this nasty discomforting stretching through here. And then I can oscillate, rotating just a little bit backwards with my right shoulder going back. I can oscillate back like this as I lean and rotate in through there and oscillate in that, few inches in that area. And you'll feel that muscle just alleviate and start to stretch out and through that particular area. Anyway, if you have any questions with this video, feel free to drop them off in the comment section below. We appreciate you watching. We thank you. Please give us a thumbs up, like the video, and subscribe so that way you don't miss any videos coming up here in the near future. And obviously, if you got people that you know are having problems such as this or any of the other videos that we may have, share them with others so that way this information can get those folks and they can start living better and healthier and pain-free life. Again, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.